Alberta Health Services. Healthy Albertans, healthy communities, together.
Good afternoon, everyone. I'm David Wyant, Chair of the Alberta Health Services Board, and I'd like to welcome you to this AHS Public Board meeting. And as always, thank you for taking the time to join us. To start, in the spirit of promoting reconciliation and gratitude, and in keeping with the calls to action from the Truth and Reconciliation Commission, on behalf of the Board, I'd like to take this opportunity to acknowledge that the work of Alberta Health Services takes place on historical and contemporary Indigenous lands, including the territories of Treaties 6, 7, and 8, and the homeland of the Métis. I would also like to acknowledge the 46 First Nations communities within what we call Alberta, as well as the Métis and Inuit peoples that we serve in our healthcare system. Our board members are joining us from across the country, and we acknowledge the Indigenous peoples' territories on which they work and live as well. We are grateful to those who have come before us and mindful of those who follow us as we steward and protect these lands. Before I address some administrative matters, I'd like to point out that this is a milestone day in Alberta's response to the COVID-19 pandemic, as a large group of public immunization has started this morning at 8 o'clock. Seniors ages 75 and older are now able to book appointments to receive the COVID-19 vaccine. And they can book online or by calling HealthLink at 811, not 911. Details and links are on the AHS webpage. Despite some technical issues this morning, as of 1 o'clock today, more than 20,000 Alberta seniors aged 75 and older are now booked to receive the COVID-19 vaccine. That's about 4,000 successful bookings per hour. Once booked, Albertans 75 and older will receive confirmation of the location, date, and time for their first and second dose appointment at a site close to home or in their hometown. I should point out that any eligible senior living in an assisted living facility, retirement home, or other congregate setting will not need to book an appointment, as AHS is working with these facilities directly to arrange times for the vaccine to be administered. Provided the vaccine arrives in Alberta as expected, all Albertans born in 1946 or earlier should be immunized by early April. AHS will continue to work with the Government of Alberta to update Albertans about who is eligible for future phases of the COVID-19 vaccine rollout. We're working to immunize all Albertans as quickly as possible based on the available vaccine supply. As vaccine is available, we are vaccinating Albertans. In the days ahead, some pharmacies will also be offering immunization. We'll continue to share information publicly as it is available. I encourage all Albertans to receive the vaccine as soon as they become eligible to do so. In the meantime, thank you to all Albertans for doing your part to stay safe and to reduce the spread of COVID. And a big thank you to all of our healthcare staff and physicians for working tirelessly through this pandemic. Now let's move on to the agenda. We are participating today by telephone conference. When I ask for a vote on a motion, I will ask for those opposed or abstaining. For those who neither oppose nor abstain, I will take it that you are in favor of the motion. If there are none or a minority who either oppose or abstain, I will declare the motion carried. May I ask that someone approve the agenda that has been circulated?
This is Sai Zoki. I move that we approve the agenda.
Thank you, Sai. Will someone second the motion?
Deborah Apps, I will second the motion.
Thank you, Deborah. Any further discussion? Any opposed or abstentions? The motion is carried. Based on the approved agenda, do any board members have a conflict of interest that they would like to declare at this time? Hearing none, we will move on. I will ask Vicki Yellowold-Woman, the chair of our Community Engagement Committee, to present two items from the Community Engagement Committee report. Vicki?
Thank you, Chair. The Community Engagement Committee met on February 18th, 2021. I will be providing a full meeting report at the March 2021 board meeting, but I am presenting two motions today that require board approval prior to March 1, 2021. The committee considered the appointment and renewal of advisory council members and the appointment of trustees to established foundations. We are very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to healthcare. As is our typical practice, given the number of appointments and renewals, the names of the members and trustees will not be read in this meeting, but will be incorporated into the minutes of the meeting and posted publicly following this meeting. First, the appointments and renewals of members to advisory councils. The responsibility to appoint advisory council members lies with the AHS board. The committee recommended the board approve the member appointments and renewals as reviewed by the committee. The board has considered such recommendation and the members support its approval. Accordingly, I move that the Alberta Health Services Board approve the appointments and renewals of members to the advisory council for the terms reviewed by the committee and the Alberta Health Services Board.
Thank you, Vicki. Will someone second that motion?
David Carpenter, I'll second.
Thank you, David. Is there any further discussion? Are there any opposed or abstentions? The motion is carried. Vicki, you have a second motion.
Yes. Second, with respect to the appointments and reappointments of trustees to foundations. The responsibility to appoint trustees to established foundations lies with the AHS board. The committee recommended the board approve the trustee appointments and reappointments as reviewed by the committee. The board has considered such recommendation and the members support its approval. Accordingly, I move that the Alberta Health Services Board approve the appointments and reappointments of trustees to health foundations for the terms reviewed by the committee and the Alberta Health Services Board.
Thank you, Vicki. Will someone second the motion?
If Sai is okay, I second the motion.
Thank you, Sai. Is there any further discussion? Any opposed or abstentions? The motion is carried. Thank you again, Vicki. I now ask David Carpenter, Chair of the Finance Committee, to present the final motion from the Finance Committee report.
Thanks, Mr. Chair. The Finance Committee met on February the 19th, 2021, and I will be providing a full meeting report at the March 2021 board meeting. But in the meantime, I'm presenting one motion for approval today, as board approval is required prior to March the 1st, 2021. The committee reviewed renewals and amending agreements for multiple continuing care facilities across Alberta and recommended same for board approval. Board approval is required in accordance with Policy 1100, Delegation of Authority and Establishment of Controls for Commitments. The board reviewed the proposed renewals and amendments, and the members support the approval. Accordingly, I move that the Alberta Health Services Board A approve the following. 1. An amendment to the Master Services Agreement between AHS and all Seniors Care Living Centres to extend the provision of supporting living services at St. Albert Retirement Residence for 5 years from March 1st, 2021. 2. An amendment to the Master Services Agreement between AHS and Bethany Care Society to extend the provision for special program services at the Bethany Calgary facility for 5 years from April 1, 2021. 3. An amendment to the Master Services Agreement between AHS and Covenant Care to extend the provisions of supporting living services at St. Thomas Health Centre in Edmonton and Chateau Vitaline in Beaumont for 5 years from April 1, 2021. 4. An amendment to the Master Services Agreement between AHS and Hardesty Care Centre Partnership to extend the provision for specialty unit long-term care services at Hardesty Care Centre in Edmonton for 49 months from March 1, 2021. 5. An amendment to the Master Services Agreement between AHS and the governing body for the Salvation Army in Canada to renew the provision for supporting living services at Grace Manor in Edmonton for 5 years from April 1, 2021. 6. An amendment to the Master Services Agreement between AHS and Excel Resources Society to extend the provisions of supporting living services at Baldwin Villa in Grand Manor in Edmonton for 5 years from April 1, 2021. And 7. An amendment to the Master Services Agreement between AHS and Prairie Lake Seniors Community Partnership to extend the provisions of supportive living and long-term care services at the Grand Prairie facility for 5 years from April 1, 2021. And B, delegate to the President and Chief Executive Officer to sign the necessary documents to effect all of the amendments so approved. I so move.
Thank you, David.
Second that.
May I have someone second? Oh, great.
Second the motion.
That was Stephen?
Sorry about that. Yeah,
Thank you.
Second the motion.
Thanks, Stephen. Any further discussion? Any opposed or abstentions? The motion is carried. We've reached the end of our agenda. I declare the business meeting adjourned. Thank you again for joining us. Please stay healthy.
Together, we do amazing things every day.